It goes without saying that the heart is one of the body's most vital organs. This size muscle never rests, continuously pumping blood through your veins to keep you alive and functioning. There are several things that may go wrong with this crucial organ. 1 in 4 deaths in the United States may be attributable to cardiovascular disease. If you pay attention to your body and see your doctor often, you will be able to prevent cardiac problems. From toe discomfort to fatigue, these are the indications that your heart may be in danger. We are going to show you 15 early warning signs of heart disease you need to look out for. Before we get into it, please remember to like and subscribe. Let's go. Number 15. Coughing up colored mucus. Let's get the gross one out of the way first, shall we? If you have a cough that won't go away and produces mucus that is pink or white in color, this might be a warning sign of fluid buildup in your lungs, which is a typical early indicator of heart disease. Even if it appears like nothing more than a bad cold, it is still a good idea to discuss it with your doctor in order to rule out the possibility that this is a sign of a more serious condition. Number 14. Sore toes. If you haven't stubbed your toe or your shoes aren't excessively tight, there aren't many causes for toe discomfort. So, if you often have discomfort in your toes for no apparent reason, and if you notice coldness or numbness in your legs when relaxing, this might be a sign of aortic occlusive disease. Aortic occlusive disease is a vascular disorder that affects the legs. It happens when the iliac artery, which supplies blood to the legs, gets plaque-clogged or constricted. Symptoms include discomfort, numbness or cramping in the lower extremities, gangrene in the feet, and impotence in males. Drugs, physical activity, and surgery are typical therapies for aortic occlusive disease. Number 13. Jaw pain. Ever get a sharp pain in your jaw? Time to go get your heart checked. Even while the aching in the jaw may not appear very alarming, it is a typical sign of a heart attack that is seldomly discussed. Symptoms of a heart attack or other cardiac event may sometimes be felt in the jaw, the teeth, and the neck. This is more common in women. It is not limited to the left side, it may also occur on the right side, particularly in the case of women. The discomfort is a warning sign. It's a sign that something is going on that very second, right there and then. Depending on how severe it is, it might come and go at any time. Because heart disease symptoms often manifest on the skin and nails, a dermatologist may be the first physician to diagnose the condition. If you know what to look for, you may detect heart disease warning signals on your skin and nails. The following are warning signs that your skin can show you. Number 12. Swelling in your feet and lower legs. Fluid accumulation in the feet and lower legs is a symptom of many disorders that affect the heart. As the fluid accumulates, you may begin to notice swelling, which may spread as far as the upper legs and into the groin area. In medical terminology, this condition is referred to as edema, which simply means swelling. Number 11. Blue toe syndrome. Your skin may become blue or purple if you are exposed to intense cold. If these colors appear on any part of your skin if you are warm, it may be a sign that your blood isn't receiving enough oxygen and that you need to have your oxygen levels and heart function checked. This is a disorder that is referred to as blue toe syndrome, and it occurs when one or more of the blood veins in the feet get clogged. If not treated, the lack of oxygen may eventually cause the skin and the tissue below the skin to die, which can result in gangrene. This sign is referred to in medical circles as cyanosis. Number 10. A blue or purple net-like pattern on your skin. It seems like any blue is bad. When cold, this pattern appears on the skin of certain people. This pattern vanishes as soon as the skin heats up. This pattern can also form when using certain medications. If medication is creating that net-like pattern, there is often no cause for concern. This pattern may potentially be a symptom of cholesterol embolization syndrome, a condition in which tiny arteries get clogged. The obstruction may cause harm to tissues and organs, thus it is crucial to contact a doctor to see whether you have undetected heart disease. This is known medically as livedo reticularis. Number 9. Xanthelasma. If you have yellowish-orange growths on your skin, you may have cholesterol deposits under the skin. These deposits may manifest in a variety of locations, including the corners of your eyes, the lines on your palms, and the back of your lower thighs. Consult a physician if you see these growths on any region of your skin. You may need a cholesterol test or other medical examination. Unhealthy cholesterol levels need treatment, which may help you avoid fatal heart disease. Controlling your cholesterol levels may also aid in the elimination of skin growths. If the growths persist, they may be treated by a board-certified dermatologist. Number 8. A fluttering feeling in your chest. If you notice a fluttering or thumping sensation in your chest, this is the most prevalent symptom of atrial fibrillation, and it's a good sign that you may be suffering from the condition. This specific kind of irregular heartbeat is brought on by the quivering of the atria, which is brought on by the irregular firing of electrical impulses in the heart. If you are having this sensation, you should make an appointment with your doctor as soon as possible. This is particularly important considering that people who have atrial fibrillation have an increased risk of strokes. Number 7. Severe headache. If you have a bad headache that simply won't go away, you shouldn't just pop some pills and hope for the best. Consider it a warning that you could be overlooking something important. Some specialists believe that your headache may be the result of a blood clot in your heart or a stroke, particularly if you have been experiencing nausea and dizziness in conjunction with the headache. Don't put off getting help since irreparable harm could occur. Number 6. Slow heart rate. Arrhythmias of the heart is characterized by deviations in the normal rhythm of the heartbeat, and although many people are on the lookout for a racing or fluttering heart, bradycardia, which is characterized by a sluggish heart rate, may also be a sign that something is wrong. Make an appointment with your primary care physician if your heart rate is lower than 60 beats per minute. Although it does not always cause a problem, there is a possibility that it is preventing your heart from giving your body enough oxygen, which may result in issues such as dizziness, chest pains, and other problems. Number 5. You can't exercise as hard as you used to. Even if you are not experiencing severe shortness of breath, you may notice changes in your exercise capability. A progressive decline in exercise tolerance may indicate deteriorating cardiac function. You may experience everything from fatigue and weakness to more serious symptoms such as chest discomfort. Occasional shortness of breath is perfectly natural, but experiencing a continual fight to catch your breath is not. If climbing the stairs suddenly becomes more difficult than it used to be, it might be a symptom of a heart problem. People may assume they are just out of shape, but going to the gym while your heart is in this state could actually cause a heart attack. Number 4. Excessive perspiration. According to research, profuse perspiration may be an indicator that a heart attack is about to occur, even if the individual isn't exercising or being very active. And this, of course, indicates that you will need to get to the doctor as soon as possible, particularly if the profuse sweating is accompanied by pain in the chest, arm, neck, or jaw. Number 3. Open sores on your feet. Any open sores that are taking a long time to heal or not at all on your feet should be checked out by a doctor. This is because open sores on your feet could be a sign of a specific heart condition known as Aortoiliac Occlusive disease, which is a blockage of the aorta, which is your body's main blood vessel. The failure to seek treatment for this ailment might result in the death of tissue, also known as gangrene, which, if handled improperly, could ultimately lead to the loss of a limb. Number 2. You're experiencing confusion or memory loss. Have you been feeling off lately? As a result of insufficient blood flow caused by heart failure, fluctuating levels of certain compounds in the blood, such as sodium, may induce confusion, memory loss, and cognitive impairment. When the brain does not get sufficient oxygen-rich blood, cognitive function is impaired. Initial feelings of lightheadedness or vertigo may be among the first indicators of this condition. Additionally, lightheadedness may be a side effect of some drugs or over-medication. As heart failure worsens, it may affect a person's ability for clear thinking. This may interfere with your ability to work, drive, live alone, and communicate. Number 1. intense back pain. The connection between heart illness and back pain has been the subject of a significant number of studies. People who suffer from heart issues and problems are more likely to complain of back pain than those who don't. There are other cases in which the connection runs in the opposite direction, with back discomfort leading to cardiac problems. If a person has a history of blood clots or significant back pain, the likelihood of them having a heart attack is increased. The management of heart disease is a collaborative process. It encompasses everyone from your family to your healthcare team, but most importantly, it involves you. Keeping a record of your symptoms and making a note of any shifts in your health will help you in spotting the warning indications of heart failure in its earlier stages. You may help yourself and your heart live a long and healthy life by making some simple adjustments to your diet and exercising on a regular basis. Keep that muscle healthy. Watch these videos for more content. Please like and subscribe, and thank you for watching.